Hello everyone, I am Dr. Sharvil Gadave from Kolhapur. First, I would like to thank Dr. Shashank Shah and the entire team for organizing such a wonderful conference. Today, I'll be talking about a very interesting topic. Is plant-based diet enough or best? What does the literature say? Plant-based diet. What is a plant-based diet? Diet comprised of mostly plant foods. Does not mean vegetarian or vegan. Plant foods include fruits, vegetables, nuts and seeds, whole grains, beans and legumes, coffee, tea, dark chocolate, and so on. Why a plant-based diet? Studies have shown it can decrease risk of many chronic diseases, cancer, diabetes, heart disease, high blood pressure, cholesterol, and so on. How do you define a plant-based diet? Unfortunately, there is no single definition, multiple definitions. However, we need to standardize the definition of plant-based diet. Other terms associated with plant-based diets can be lacto-ovo-vegetarian. So what does that mean? So no flesh, but may have eggs, dairy. There is a concept of vegan, that is no flesh, no eggs, no dairy, no honey. Pesco diet means in which fish is allowed and seafood is allowed. And semi-pesco occasionally includes beef, pork, and poultry. So number of definitions, number of different terminologies. What are the health benefits of vegetarian diets? Now, the possible health benefits have been discussed in multiple aspects. But what does the literature say? What is the hard evidence? What do randomized trials tell us about the benefits of a plant-based diet? Let's try to look at this important topic. Now, this is one study published in Nutrition and Diabetes, a plant-based diet in overweight individuals in 16-week randomized clinical trial, metabolic benefits of plant protein. So the background of this particular study was that a plant-based diet is an effective strategy in treatment of obesity. This was a 16-week randomized clinical trial. Interestingly, in this study, number of results were discussed. So overweight participants, 75 participants participated in this particular study. There was a control group as well. DEXA was used, multiple other parameters were used. The insulin resistance, the insulin sensitivity was measured, body composition was analyzed. So this was a well done study. What were the results? So the mean weight of patients in this particular study was around 92 kg, and a plant-based diet over 16 weeks showed a reduction in weight of around 6.5 kg. Mean BMI was around 33 kg per meter square, and a reduction of around -2 was seen. Mean fat mass was around 40 kg in the participants, and a reduction of around 4 kg was seen. So the good thing is that beneficial results were seen. However, if we closely look at the data, we realize that this is a short study. This is a 16-week study. The results are good, but not as robust as one would expect from similar trials done with other interventions. For example, either a GLP-1 agonist therapy or the results after bariatric surgery. So compared to the intervention-based options, what we have, a plant-based diet will have outcomes which are very modest, but the good thing is some weight reduction in BMI, fat mass is definitely seen. This is another meta-analysis, vegetarian diets and glycemic control in diabetes, a systematic review and meta-analysis by Dr. Yokoma and group. 477 studies were identified in this meta-analysis. 6 met the inclusion criteria. 255 subjects from these 6 studies. Mean age was 42.5 years. Consumption of vegetarian diets was associated with a reduction of HbA1c. However, how much reduction was seen? So in the 255 participants, mean age 42, their mean HbA1c was around 8%, and the reduction seen was roughly 0.39%. And there was no significant reduction in fasting blood glucose. The reduction in HbA1c was significant, but was in the tune of 0.39%. So yes, plant-based diet did help patients reduce HbA1c, but the reduction was very modest and no significant reduction seen in other parameters like the fasting blood glucose. So what is the right diet? Definitely a plant-based diet helps. However, on its own, plant-based diet has very modest results, but definitely it will complement the results which we see with other interventions like the SGLT2 inhibitors, the GLP-1 agonists, and more aggressive interventions, more robust interventions like bariatric surgery. This can supplement these interventions, but on its own, it has very modest results. Another systematic review and meta-analysis. It looked at the association between plant-based dietary patterns and the risk of type 2 diabetes. This was again a robust meta-analysis. Large number of patients were assessed and the findings were positive. A significant inverse association was observed between higher adherence to a plant-based dietary pattern and risk of type 2 diabetes. Relative risk of 0.077%. Confidence interval, you can see, does not cross unity. So the relative risk was significant. So there was a benefit with plant-based diet, especially when they are enriched with healthful plant-based foods. It may be beneficial for the primary prevention of type 2 diabetes. So yes, definitely there is a role in primary prevention of type 2 diabetes. We need to educate the masses to have a healthy lifestyle, healthy eating habits, and plant-based diets have a definite role in this particular aspect. Another good review, I would say, published in PLOS One. It looked at the cardiometabolic risk factors in vegans, a meta-analysis of observational studies. 40 studies with 12,000 plus vegans and 1,79,000 omnivores were included. A very robust study, large number of patients. From food frequency questionnaires in 28 studies, vegans compared to omnivores consumed less energy, minus 11%, which was good, and less saturated fat, almost 50% less saturated fat. So these were the benefits. However, if we look at the hard endpoints, compared to controls, vegans had a lower body mass index, but what was the reduction? It was minus 1.72 kg per meter square. So that is a good reduction, but not a very robust reduction. Reduction in waist circumference, minus 2.35 centimeters. Again, a very modest reduction, not a robust reduction. Fasting blood glucose, also some trend in reduction, but not a very robust reduction. This is another important review which has covered a number of studies. This was published in the Journal of Geriatric Cardiology. This is a review of plant-based diet for overweight and obesity prevention and treatment. This particular review came out with a number of observations and also cited number of limitations in the literature and the published data we have for plant-based diets. So what this review says is that there is a need to study use of plant-based diet for weight loss with more diverse populations, including racial, ethnic minority groups, males, young adults, children, and older adults. So a lot of more studies are required before we come to any conclusion. To date, there have been no plant-based diet weight loss interventions solely among older adults. So that data is lacking. Most of the weight loss interventions conducted with senior adults using standard diet approaches have been of low to moderate quality. Moreover, plant-based diet weight loss trials that last beyond 18 months are needed. Till date, most studies have been short studies, and we require more studies with longer durations in order to examine long-term health benefits and diet sustainability. Another limitation of plant-based diet weight loss trials which have been done till date is that very few of them have reported the physical activity level of participants, which can be a very important confounding factor. For example, from the Bernard et al. Systematic review, only 3 studies addressed changes in physical activity, with 2 studies seeing an increase in physical activity during their interventions, and 1 reporting physical activity remained unchanged. So the studies that are available probably are not that well designed, and we need more studies with more robust uh, designs to analyze the clinical outcomes in a better way. So this is how a plant-based food plate would look like. So it will have a lot of leafy green vegetables, high-fat whole foods such as nuts are allowed. It will have fruits, it will have legumes, it will have whole grains. So this is a healthy pattern. We should encourage patients to consider this as one of the options. However, the results are modest. We cannot depend solely on the results from a plant-based diet to improve obesity over a long time or to improve diabetes control over a long time. We need to take help of more robust interventions like drug therapies, including SGLT2 inhibitors, GLP-1 agonists, and important interventions like bariatric surgery wherever indicated. Are there any nutritional risks associated with vegetarian diets? Yes, vitamin B12 deficiency is a very important risk factor. We should always keep this in mind whenever we see a patient following plant-based diet. Also, essential fatty acids, there can be development of deficiency, including that of DHA. So all this needs to be considered. Even the iron status of patients following plant-based diet can deteriorate and they can have iron deficiency, and we need to correct this. So the bottom line for those choosing plant-based diet is such diets do not provide adequate amounts of direct sources of vitamin B12 or long-chain essential fatty acids, including EPA and DHA. We should help patients recognize supplemental needs for B12, EPA, and DHA whenever they continue on a plant-based diet. We should be aware of the symptoms of B12 deficiency, the possible risks with B12 deficiency. And all this needs to be kept in mind whenever we see or advise or follow up a patient doing plant-based diet. So ladies and gentlemen, to conclude, we can say that plant-based dietary patterns, especially when they're enriched with healthful plant-based foods, may be beneficial for primary prevention of type 2 diabetes. Plant-based diet is associated with improvements in body composition and reductions in body weight and insulin resistance. However, there is no robust improvement in HbA1c, and it is not comparable to improvements seen with drugs like GLP-1 agonist and bariatric surgery. Consumption of plant-based diets helps in improving glycemic control. However, the robust improvement cannot be expected, and we need to consider using appropriate therapies, interventions in addition to plant-based diet. Such diets do not provide adequate amounts of dietary sources of vitamin B12 or long-chain essential fatty acids, and we should help patients recognize supplemental need for all these vitamins, including B12. Plant-based diet weight loss trials that last beyond 18 months. More long-term trials are needed in order to examine long-term health effects and diet sustainability. So I would like to end this talk. I again thank the organizers for organizing such a wonderful conference. Thank you.